Hi, this is Dr. Linda Burke-Galloway, author of the Smart Mother's Guide to Prevent a Pregnancy, blogger and OBGYN physician. I want to talk to you briefly about vaginal birth after C-section, aka VBAC. In our country, 1 out of every 3 deliveries is a C-section. That's roughly 33%. If you had an initial C-section, or let's say you had a vaginal birth and then for some reason there was an obstetrical emergency and they did a C-section, should you have another C-section? Well, here's what the statistics say. If you've had a successful vaginal delivery, even if you've had a previous C-section, 89% of you will have a successful VBAC. So here's the issue. If you want to have a VBAC after having a C-section, if you go into spontaneous labor on your own, the chances are better that you will have a successful VBAC. If you are going to be induced, if only 1 medication is necessary to start labor as opposed to 2, you will probably have a successful VBAC. I had a patient who had 3 previous sections and she was pregnant with her 4th baby. The plan was to do a repeat C-section. But when she entered the hospital, she was already dilated 8 centimeters. Was I going to do a repeat C-section on her? Absolutely not. She went into labor, she was already in labor, but she progressed very nicely and had a successful vaginal birth after C-section. So, in summary, if you are contemplating having a VBAC after having a C-section, if you go into labor on your own, the chances are better that you will probably be successful. If they only have to use 1 medicine as opposed to 2, the chances are that you will probably have a successful VBAC. However, if they don't know what kind of incision you had on your uterus, it's probably best to have a repeat C-section because the incision could have been up and down on the uterus, not across the skin. That's called a phalansteal. But if it's up and down on the uterus, then your chances of having a uterine rupture will probably be increased. But if that is not your situation, then I strongly urge you to advocate for a vaginal birth after C-section because the risk and complications are much less than having a repeat C-section. This is Dr. Linda Burke-Galloway, author of the Smart Mother's Guide to Prevent a Pregnancy, reminding you that a healthy pregnancy doesn't just happen, it really takes a smart mom who knows what to do.